Today, we're going to break down a procedure that is absolutely fundamental to client safety and honestly to your professionalism. We're talking about the sensory assessment. And look, this isn't just some box ticking exercise, it's a powerful protocol that protects your client and really empowers you as a practitioner. So let's get right into it.
So let me ask you this. If a client can't feel excessive heat or pressure, or maybe even an electrical current, how are they supposed to tell you that something is wrong? The simple answer is they can't. And that right there, that's the core problem this simple, elegant procedure is designed to solve, before you even think about starting a treatment.
So, why is this test your absolute first line of defense? Well, it all comes down to confirming that a client's sensory perception is actually working the way it should be. What we're really doing here is checking that the client's nerves are responding normally, that the messages are getting through. If they're not, maybe because of a condition like diabetes, an old injury, or some kind of nerve damage, that is a major contraindication. It's a huge red flag that tells you certain treatments could be unsafe. So this quick check makes sure you're starting from a place of safety, right from the get-go. Okay, preparation is everything. I can't stress this enough. Nailing this part means your results are going to be accurate and the whole process feels professional and totally reassuring for your client.
And the best part, your toolkit is incredibly simple. For the thermal test, all you need are 2 test tubes, one with some warm water, one with cold, and a few tissues. For the tactile test, a single cotton bud. That's it. It's accessible, it's easy, and it is super effective. This whole process is really about clear and kind communication. First, get your client comfortable. Then, explain what you're doing and why you're doing it, and of course, get their consent. Instructing them to close their eyes is absolutely key. It takes away any visual clues and makes them focus only on what they can feel.
All right, let's walk through the first part of this assessment. We're going to start by testing for temperature sensitivity. And this is your script. It's simple, it's direct. You're telling the client exactly what's about to happen and what you need from them. Keeping it clear like this is just crucial for a smooth and accurate assessment. Okay, step 1 is totally non-negotiable. Always test the temperatures on your own wrist first. It's just a common sense safety check. Once you've confirmed they're good to go, you'll gently touch their skin with the cold tube, then the hot tube in different spots, asking for their feedback each and every time. It's really just a simple game of call and response. You ask a direct question, and you're looking for a direct, correct answer. It's a really clear, binary check of their thermal perception. Okay, now let's move on to the next test. So now we're going to shift from temperature over to touch. This part of the test looks at the client's ability to tell the difference between different kinds of physical contact. And just like with the thermal test, a clear and professional script is your best friend here. You're setting the stage, letting them know about the 2 distinct sensations they're about to feel. No surprises, just clear communication. So using your cotton bud, you'll first apply the soft cotton tip. Then, in a different area, you'll gently touch the skin with the sharper wooden or plastic end. And it is so crucial to be gentle here. You are not poking or pressing, you're just making light contact to see if the nerve responds. And just like before, it all comes down to a simple, direct exchange. You provide the stimulus, and you ask them to identify it. Their ability to correctly name soft or sharp is what confirms their tactile senses are functioning just as they should be. So you've completed both tests, you've got your answers. Now comes the most important part, interpreting that feedback and deciding what to do next. And honestly, the decision here is completely unambiguous. There's no gray area. If the client identifies everything correctly, fantastic. You've got a green light. Document the results and proceed. But, and this is a big but, if they cannot feel or correctly identify the sensations, that is a hard stop. You do not proceed. The only right move is to refer them to a medical professional. This is the moment that truly defines your commitment to client safety. Okay, to wrap things up, let's quickly go over the golden rules. These are the non-negotiables that you should carry with you into every single client assessment. Let's just recap the fundamentals real quick. First, and you've heard me say it a few times, always test on yourself first to ensure safety. Always. Use clean, disinfected tools every single time. Keep it professional, and remember, never use extremes of temperature or pressure. This is just a test, not a trial. And finally, document everything. Your client's consultation form is that official record of your due diligence. So when you think about it, this sensory test is a small, super quick protocol, but its impact on safety is absolutely massive. It's a great reminder for all of us to think about What other small, seemingly simple protocols have the biggest, most positive impact on your practice?